Primitive reflexes are reflexes that we're all born with, and initially they serve a very important function. These reflexes are, by definition, involuntary, and as the brain and nervous system develops, the involuntary reflexes should be replaced by stronger voluntary control. However, if this doesn't happen, these reflexes can get in the way of learning. The ATNR, or asymmetrical tonic neck reflex, has been extensively studied. It's also called the fencing reflex. With this reflex, when the head is turned, one side of the body is extended, with the eyes looking in this direction, and the other side of the body is flexed. And you can see here Hannah beautifully displaying this reflex. If this reflex persists beyond 6 months of age, it can make it difficult for the limbs to move independently of one another. It can make it difficult for the child to bring their arms together, for example, to clap or to feed themselves, or to bring a toy to their mouth. It can make it difficult for the child to bring their limbs across the midline of their body, which can affect balance, coordination, and even writing. With writing, we need to bring our hands across the midline of the page. And because the reflex determines where the eyes are looking, it can make it difficult for the eyes to scan horizontally, for example, for reading. The STNR, or symmetrical tonic neck reflex. This is another reflex which normally disappears around 8 to 11 months of age. The reflex is useful because it helps the child get up on all fours for crawling. With this reflex, the movement of the head and eyes is linked to symmetrical movement of arms and legs, so that when the head is flexed, the 2 arms bend and the 2 legs extend, and the eyes also focus on near objects. When the child looks up, the eyes focus on far objects, the knees are bent, and the arms are straight. And just like the previous reflex, if the STNR persists, it will interfere with independent movement of the limbs and the eyes, so that coordination, balance, and posture may be affected. Bringing the eyes together to focus on an object, visual accommodation, may be affected, and vertical tracking of an object may also be affected. I think it's fair to say that we all have retained reflexes to some degree. However, when we retain a number of these reflexes, they can begin to have an effect on normal movement and brain processing. In children with Down syndrome, this may well be the case. Children with Down syndrome typically will have retained reflexes coupled with poor muscle tone and altered sensation. All of these may have an effect on motor skills and on how the brain processes incoming information. Here's a little clip of Hannah making her way across the floor. And you can see she's using both arms together and both legs together. And that's not uncommon in children with Down syndrome to be slightly unconventional in their way they begin to crawl. And it's important that we pick up on this and do whatever's necessary to ensure that crawling does happen in the expected fashion. And that's because crawling is actually important also for brain development, for communication between the 2 sides of the brain, for the brain to process information. The Hannah Trust is a charity. We aim to find medical interventions that make a difference for our children with Down syndrome. You can make a donation to support the Trust at www.hannahtrust.org.